Hello everyone, I am Dr. Rohini Ruhil. Today we will talk about the relationship between health and development. In simple logic, it seems that as a nation progresses towards more development, the health conditions of its population improves. And the logic we give behind this is that with the development, we are able to put in more resources into the taking care of the health conditions of the population, and thus with more development the people will be more healthy, and vice versa. If people will be healthier, they will be able to contribute towards the development of its country, and thus it seems as if health and development are synonymous, that they are directly proportional to each other. But actually, the relationship between health and development is a little complex. It is not that simple. So, what do you think? Is there a clear improvement of health with development? If a nation progresses towards development, it becomes more and more development. Does it lead to a clear improvement of health of its population? Actually, there are some major problems. Diseases caused first major problem is diseases caused by industrialization and urbanization. This also depends upon our definition of development. How do we define development? In some other video, we will study about various indicators of development, and thus it varies from institution to institution, from one school of thought to other school of thought, that how do they define development, and thus the relationship between health and development. And if we take industrialization and urbanization as development, then with industrialization and urbanization, people tend to migrate from rural areas to urban areas. And there they are forced to live in slums, they are forced to live in filthy living conditions where the sanitation facilities are not proper, they do not get safe drinking water, and they suffer from the double burden of communicable as well as non-communicable diseases. There is also a problem of inequities and unequal health status. That is, the fruits of development are not equally shared by all the sections of the society. Generally, the rich and the upper strata of the society, they get benefited from the development, whereas the poor class, the labor class, they burn the grint of the development. They do not get access to the health facilities, they do not have resources, and they do not the development do not trickle down to the poorest of the poor. And the third major problem is the imposition of macroeconomic adjustment that has resulted in major cuts in the health and social budgets. This has been discussed by various scholars that the structural adjustment policies during neoliberalism, where the countries were put in the debt, there were conditionalities attached to loan, and to compensate for that fiscal deficit, there were major cuts in the health and social budgets that affected the health of the populations, especially the downtrodden strata of the society. So these are some major problems due to which it is not necessary that with more industrialization and urbanization, the people will be more healthy. And this is not true for all sections of the society. This may be true for some sections of the society, but for a nation as a whole or a society as a whole, this generalization is not true. And basically, industrialization and urbanization equate with a different set of health problems. Like with more development, as we progressed towards industrialization and urbanization, there were a different set of health problems, which we will discuss in detail in our next video. And this transition towards the different set of health problems, this is epidemiological transition, which we will discuss in the next video. So to be continued. Thank you for now. Thank you for watching. Bye bye.